My name is Purnanand Guru. I'm one of the orthopedic spinal surgeons. I'm going to talk about the lumbar disc prolapse today, and I'll divide into the causes, symptoms, a diagnosis, as well as the treatment options, and also a red flag symptoms. What is a disc prolapse? Disc prolapse is when the disc pops out from the space and it causes compression on the nerves which passes through, as well as the canal, which can be causing stenosis of the canal. The symptoms, which involves a low back pain and leg pain, which is more called a sciatic type of pain. It can be associated with a numbness and tingling, and it can be a radiculopathy type of pain all the time. And it does cause sometimes weakness. And the more worrying thing is something called a cauda equina syndrome, which involves bladder, bowel, not able to control it, and sudden leg weakness, which might result in cauda equina. How do we diagnose these ones? We diagnose these ones by doing a clinical examination, which involves examining your posture, examining your movements, examining your reflexes, examining your strength in the legs. And we also examine your back to see any other deformities which can cause these type of problems. And we do measure the severity by doing a straight leg raise test, which will give us an idea how significant is your pains. I'll be investigating in the form of an MRI scan, which is the gold standard, and a commonest investigation, which we do it for the disc prolapses. And we might need to do sometimes a CT scan on X-rays during this one, because sometimes we need to know whether any bony problems which is causing the disc prolapse as well. And we rarely need to do a nerve conduction study. Sometimes if it's inconclusive diagnosis, which might give us an idea to refer to some other specialties. The treatment modalities, which involves mostly a conservative treatment, 60% of the patients will settle with the conservative modalities in the form of physiotherapy, pain medications, as well as heat and ice, and regular exercises, which mainly involves swimming. Sometimes we might not do any heavy lifting stuff, which might make it worse regarding the disc prolapses. The second option of the treatment modalities is an epidural injections or a nerve root block injection, which will help you to relieve your symptoms, and sometimes a smaller disc which might regress and which might settle with the pain. The last option is a discectomy surgery, which involves we need to take some bone to shave it in the back, and we might need to shave your disc as well, which is causing the pressure. It doesn't mean that we remove the whole disc, but it does take off your pressure from the leg, which can improve it. And always remember the cauda equina syndrome, which involves bladder and bowel, which might need to present to the emergency department regarding that one.